It's one piece aimed at curbing the opioid abuse problem. So far, it appears to be working.
It seems to have made a difference because along with the rules came education. The public's more aware of the dangers.
Since January of 2017, new guidelines require medical professionals to assess the risk of a patient before writing a prescription. The patient has to sign an informed consent form, and the prescriber has to check a database to make sure the patient isn't trying to get drugs from multiple doctors.
4 out of 5 people who are abusing street drugs started with pills, and the goal was to reduce the number of pills being prescribed.
According to the state's prescription drug monitoring program database, there was a 15% decrease in the number of pills prescribed last year. The most prescribed drug was anxiety medication, with 248,000 prescriptions, followed by almost 238,000 of oxycodone and 172,000 of tramadol. Dr. William Goodman, Chief Medical Officer of Catholic Medical Center, says healthcare providers are now more aware to give opioids, but only when necessary. But it's also created some issues.
Unfortunately, some of the safer alternatives are at times more expensive than the pills, and that's caused some challenges being able to afford that.
CMC collects medications through its drug take-back box in its lobby, and doctors now give these charcoal deactivation packets to patients who receive opioids, a safe way for them to destroy excess medication. The hospital is about to conduct a study in the emergency room to see if alternative treatment is working.
About 10% of people who come to the emergency room after an overdose will die within a year. Many of those die within the first few months. So during that interaction in the emergency room, it's an opportunity to start them on therapy so that they can be on something before they make it to a clinic.
Mike Cronin, WMUR News 9.